Hi there. So I'm Dr. Kara Flamer, expert in women's health, and I have a practice in bioidentical hormone therapies. And what I wanted to talk with you guys about today is very briefly, what is bioidentical hormone? What are bioidentical hormones? And I know a lot of people have heard about it. We also refer to it as BHRT in contrast with HRT. So in case you haven't heard, very simply and quickly, what are bioidentical hormones? So bioidentical hormones are exactly as they sound. They are hormones that are biologically identical to your body's hormones. So their chemical structure is the same as your body's hormone. So if we are going to take a hormone and put it in our body, we want to use something that's exactly the same as what our body would make, right? We want to use something that our body knows how to process, it knows how to handle, it recognizes, it's going to treat it as if your own body made it. That's intuitive, right? Like, why would we use something that's not bioidentical, especially if we have this as an option? So that's what a bioidentical hormone is. Now, some of the commercially available hormones that we refer to as HRT or the birth control pill, some of those contain bioidentical substances. So for example, the birth control pill contains estrogen, which may be bioidentical. However, you're swallowing it, which means there's a bit of risk with it compared to when you use a topical cream, which is safer. But at least the estrogen component in the pill is bioidentical. The progesterone component of the pill is not. And there lies a problem because it's not the same as what the body makes. So your body sees it and says, what is this? And it has to take off chemical groups and add chemical groups and modify it in order to get a recognizable, usable product. In doing so, we get a higher risk: breast cancer, stroke, heart attack, etc., etc. Now, that's the pill. The other commercially available hormones are for menopause, and so they would be estrogel, Estradot, Clemera patch, Viveldot. There's all sorts of patches and gels that you can put on your body. There's some estrogen rings you can insert. There's Premarin. So there's all sorts of estrogens. And then there's two types of progesterone, Prometrium and Provera. It's a mixed bag. Some of these are bioidentical, some are not. All of the patches, the gels, like the estrogel, the Estradot, the Clemera, those are bioidentical. The estrogen rings, anything that's 17-beta estradiol, they're bioidentical. The estrogen that is not bioidentical is Premarin, which comes from horse urine. It's bioidentical to a horse, not to a woman, not to a human woman. And so, of course, when your body sees that estrogen, it has to modify the chemical and, again, add groups and take away groups. And in that process, we get more risk. With progesterone, Prometrium, which is commercially available, made by a pharmaceutical company, is bioidentical. It's a great progesterone. Progestin, in the form of Provera, is not bioidentical, and then we get more risk. So within each of these options, there may be bioidentical or not. Now, if you work with a bioidentical hormone doctor, they generally don't use the commercially available products. They often will customize your hormone based on your own personal needs, and you'll get a personal dose. Those hormones are always bioidentical when they're used, and they're usually given in the safest form, which is topical for some of the hormones. Other hormones are safe to take orally, so you need to work with your practitioner to be kind of educated about that, but you never want to swallow estrogen if you don't have to. It's better to take it topically. For some of the other hormones like progesterone, it doesn't matter, oral or topical. There is advantages and disadvantages to each, but they're both safe. So the take-home message for today is to understand that bioidentical means biologically identical, same structure chemically to your body, and that our bodies do best when they are exposed to substances that are the same chemical structure of what they're used to making. They will handle it better. You will have the least amount of side effects and risks. It is the safest of all options. So I hope that helps, and thank you for watching.